Hello everyone, today we are going to talk about heart failure. Does one of your parents or relatives suffers from shortness of breath and tiredness just by walking for a few steps or making a simple effort? Do they have swelling in both feet? Well, they may have heart failure. Heart failure does not mean your heart has stopped working. It just needs some support to help it work better. Heart failure is a long-term condition that tends to get gradually worse over time. It cannot usually be cured, but the symptoms can often be controlled for many years. During this video, we will explain to you everything related to heart failure, the symptoms, how to diagnose it, and the available treatments for it. Our role today is to answer most of your questions regarding heart failure. Today we have Dr. Lim, who is a leading doctor at Hanyang University Hospital. He's going to discuss with us everything about heart failure from an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you will be updated with our new releases. So we'll move on to heart failure. Dr. Im, what is heart failure?
Failure of any organ means it is not functioning properly. Various factors contribute to organ failure, such as angina, hypertension, and valvular diseases. Heart failure refers to malfunctioning of the heart due to these various cardiac pathologies. Therefore, prevention is very important. Aging may cause these pathologies and eventually lead to heart failure. Heart failure, as I've explained, the heart has to contract in this manner to pump our body with blood and nutrients. In heart failure patients, it would contract in this way, so insufficient contractile forces would lead to. Think about it. It can't squeeze well. This leads to blood status, and blood comes from the lungs before the heart, and when the blood pools in the heart, it would not circulate as well and keep pooling like in a dam. Then the blood from the lungs would not be able to enter the heart. This leads to pulmonary swelling, water in the lungs. If this becomes severe, that person can't lie down. Some have severe swelling in the legs. These people have to be well managed in a way that they can breathe without discomfort. Another aspect is to help these patients adjust to their daily lives without suffering these heart failure symptoms.
So for the symptoms, because the blood circulation is not done well, so it's like pukido.
The key organ to our bodily circulation is the heart, and when it malfunctions, all the blood in our body starts pooling, leading to peripheral edema and pulmonary edema. Thankfully, there are many drugs that can promote cardiac function. In the past, we only had a few, like diuretics and digoxin. Fortunately, there are better drugs available.
Are there different types of heart failure then?
Heart failure. There's a chronic heart failure. This refers to well-controlled heart failure, and then there is acute heart failure. The latter warrants a visit to the emergency department. You aren't able to breathe in acute heart failure.
Who is more at high risk of heart failure?
The aforementioned hypertension, acute myocardial infarcts, angina, diabetes, dyslipidemia are all risk factors of heart failure.
Okay. So can people sometimes have a heart failure and they are not aware of it?
Patients with a well-managed heart failure can go through with daily life if they take their medication, but there are certain aggravating factors, such as the simple cold or emotional stress. These factors can sometimes exacerbate heart failure in an acute manner, so it is possible when patients take their meds and take care to prevent these exacerbation factors to have a more or less normal life.
How about the treatments? Are there any treatments for heart failure?
Heart failure treatment for cases where medication is not enough. There are other treatment options that have been developed. First, this depends on each individual. There are cases when the heart has to beat in this manner, but instead, theirs go like this. So they have dysynchrony. These individuals can synchronize with a device insertion, so a device therapy. Secondly, there is heart transplantation if the individual cannot go on with their daily life. Heart transplantation can make it possible for them to live further. Heart transplantation is performed quite frequently in Korea.
What are the ways to prevent heart failure? Are there any ways to prevent it?
For example, as I said, heart failure is a complication of multiple diseases. It is thus important to prevent the preceding causes. If you have angina, you should be treated by all means. If you have diabetes, you should receive anti-diabetic medication. And if you have vascular disease, you need the necessary surgery for the valvular disease beforehand, and also pay attention to your blood pressure management.
So is diet directly related to heart failure? Alcohol, smoking?
Yes, that's a very significant question. A set of heart failures occurs due to alcohol ingestion. Alcoholics suffer more frequently from arrhythmias and heart failure. Those people have to absolutely stop drinking.
So I would guess that in countries where alcohol is very well consumed, there will be more heart failure cases, right?
Yes, it is especially worse for those people who drink alcohol every day. There is a higher prevalence for heart failure among these people. And from what I know in people in Russia, or anywhere hard liquor is consumed, the incidence is high.
Thank you so much, Professor Lim. Today, the doctor explained in details everything related to heart failure, such as symptoms, complications, and treatment. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.